So, welcome to the webinar. Just a quick reminder that this is being recorded. If you have any questions or anything like that as we go along, please just pop them in the chat box and save them for the Q&A session at the end. So either pop them in the chat box as we go along or just save it till the end if you can remember it when we do the Q&A session at the end. Alternatively, you can pop me over an email if you do have any questions, and those of you who watch the recording, please feel free to send me over an email with any questions that you may or may not have. So yeah, if you don't want to be recorded, just let me know, and what we will do is if you do ask a question, we'll just crop that out of the recording, so when it gets sent to everyone, that bit will be cropped out. So, hello and welcome to our gut health webinar, which I'm presenting today. The aim of today is to give you a little bit more information about gut health conditions, treatment options, which treatment options are and aren't successful, busting myths and useless products, which, believe me, there are many, and finally discussing a holistic approach to treatment, what that means and what that actually looks like. So who am I and why should you listen to me or care about what I'm saying? My name is Katie. I am a registered nutritionist, and I'll go over a little bit more about what that means later on. I have a bachelor's degree in biochemistry. I then went on to do a master's degree in nutrition at the University of Nottingham, and I'm currently doing a PhD, and I'm in my third year of my PhD, which is also in nutrition at the University of Nottingham. In addition to this, I am a registered nutritionist under the Association for Nutrition. So I work as a nutritionist for Andra Health seeing clients, and I work mainly in gut health and IBS. So let's get into it. So just to, next slide, just to make you aware, the main focus of the webinar today will be on irritable bowel syndrome, which I'll refer to as IBS. It's extremely common, affecting 1 to 2 out of 10 people. And the reason that that statistic is so vague, i.e. 1 to 2 out of 10, which is obviously 1 to 5 to 1 to 10 in people, which is quite a big difference, is because a lot of people who have IBS go undiagnosed. So I just wanted to make you aware of that, so that whether you've had an IBS diagnosis or not, if you experience unwanted gut symptoms, the things that I'll be going over today are likely to be helpful for you, because when we treat IBS, the aim of treatment is to treat symptoms rather than specifically treating IBS as a whole. So, what causes IBS? We don't know exactly what causes IBS in lots of people, but we do know that there are some common things that tend to crop up a lot. So, for example, things like gastroenteritis, medication that can alter the gut bacteria. So this is things like antibiotics, non-steroidal anti-inflammatory drugs, and proton pump inhibitors, which are all very commonly prescribed drugs. Poor quality diet and lifestyle, lactose intolerance, food poisoning, surgery affecting the gut, and eating a diet high in fermentable foods. There is also new and upcoming research that suggests that eating certain foods during an infection could possibly lead to food intolerances. However, it's a new and upcoming area of research, and we need a lot more research into it. So we know that all of these things have the capability of causing IBS. However, not everybody who has gastroenteritis or who takes antibiotics will go on to develop IBS. So what we don't know is, what is it that makes some people more susceptible than others? Why is it that some people go on long-term antibiotics and then go on to develop IBS, whereas another person may go on long-term antibiotics and don't go on to develop IBS? That's what is unclear. Sometimes we also see in a patient's history that they may have had something like gastroenteritis or food poisoning a few months before their initial symptom onset, but they don't associate their IBS to it. However, that may have been one of the causes, but the symptoms may have developed very slowly and gradually over a number of months, And it may have taken a little while for them to get to the level where the person notices them. So it's always really important to get a person's history and to ask about any of these things that may have happened in the past. So in terms of IBS symptoms, I'm sure most of you are aware of the symptoms of IBS, and most of you have probably experienced at least some of them. Usually people with IBS will have sort of 2 to 3 on average of these symptoms. However, it is certainly possible to have IBS and be diagnosed with IBS with just one of these symptoms. And it's also possible to have IBS and have all of these symptoms. So it can look very different for different people. In terms of treatment options, which treatment options are successful and which treatment options aren't successful? It's really important that a specific framework is followed when we're looking at treatment options for gut issues and irritable bowel syndrome. We don't just want to go and stick somebody straight on the low FODMAP diet, for example, because there can be negative outcomes from this. And it's really important to try the safest treatment options first and only move on to secondary approaches where those primary approaches haven't worked. So there aren't many published stats on how effective primary interventions are as a whole. And this is what I mean by this is when we put all of these primary interventions together. And the reason there aren't much stats on that is because there aren't many people who take this holistic approach to treatment and who put all of these primary interventions together. So what does that mean? A holistic approach to treatment means looking at all of the different areas which could be contributing to symptoms rather than just looking at diet alone. So yes, we do look at diet, and that does form a really important part of treatment. But we also want to look at things like the gut-brain axis, the gut microbiome, stress and anxiety, and lifestyle. And it's really important to address all of these areas because they can all contribute to symptoms. And research shows that when a holistic treatment approach is taken, treatment is much more likely to be successful. If primary interventions are not successful, then we move on to the secondary intervention, which is the low FODMAP diet. That's not something that I'm going to talk about much today, but it is effective in about 75% of patients where primary interventions haven't been successful. However, what I will say is that most people who go onto a low FODMAP diet have not been through a holistic treatment plan, including all of the primary interventions. And in my experience from the clinic, when people are taken through a holistic primary treatment plan, most people tend to see a good level of improvement in their symptoms and then don't need to go onto the low FODMAP diet. So moving on to myth busting, which in my opinion is one of the most important things to make people who suffer with gut issues aware of. This is because there are lots of people who suffer with gastrointestinal issues, and this may have become so horrendous and taken over their life so much that they're willing to try anything to try and get rid of their symptoms. And unfortunately, people and companies take advantage of this and sell people non-evidence-based treatment options or products. So it's really important to be aware of what has been researched and what's been shown to work and what actually doesn't have any evidence behind it and therefore should be avoided. So the first one that I get asked all the time is, should I go dairy-free? And there is often confusion around whether people who are suffering with IBS or gut symptoms that aren't diagnosed need to cut dairy out of their diet. Dairy-free diets are actually for people who have a cow's milk protein allergy, where food that contains dairy and therefore contains cow's milk protein needs to be cut out of their diet to avoid an allergic reaction. And even a tiny amount of cow's milk protein can cause an allergic reaction. People who have IBS, where dairy may be a trigger, are actually intolerant to lactose, which is a sugar within milk. So these people don't need to cut dairy out of their diet. They simply just need to reduce their lactose intake in order to help with their IBS symptoms or their gut symptoms. So reducing lactose intake can be particularly beneficial if the IBS is diarrhea dominant, and also if the patient has suffered with gastroenteritis or food poisoning. It's worth looking at whether reducing lactose could be beneficial. So people with a cow's milk allergy, as we've said, have an allergic reaction to the proteins within cow's milk. People with gut issues where dairy seems to be an issue don't necessarily need to go dairy-free, they just need to reduce their lactose consumption. So decreasing lactose consumption would involve switching from a cow's milk to a lactose-free cow's milk or a plant-based alternative, and also switching from a dairy yogurt to a lactose-free or plant-based alternative. Lactose-free versions of milk and yogurt are normally what we recommend. And the reason for that is because they still contain all of the vitamins and minerals that normal milk contains. So it just has lactase enzyme added to it to break down the lactose. But it still contains all of the vitamins and minerals. However, if you wanted to opt for a plant milk, then you can do, or a plant yogurt, then you can do. It's just important to make sure that it's a fortified version. So calcium and iodine being the two important minerals that you want to look out for to make sure that it's fortified. However, things like butter and hard cheeses, and even some sort of middle cheeses like cheddar, which contains small amounts of milk as an ingredient, can actually usually be consumed. It depends. People tend to, it's not normally as black and white as either being tolerant or intolerant. People tend to be somewhere along the scale. So some people might be able to tolerate even small amounts of normal cow's milk, up to maybe 50 ml, like the kind of amount you might put in a tea or a coffee. And some people might not be able to tolerate that. So most people find that they're somewhere along this scale if dairy does seem to be an issue for them. So just to summarize, people with a dairy allergy, the thing that causes the issue is the protein within cow's milk. With IBS with this dairy sensitivity, the thing causing the issue is lactose, which is a sugar. With a dairy allergy, the body's reaction is an immune response, an allergic reaction. And with IBS with dairy sensitivity, it is not an immune response. It doesn't involve the immune system in any way. What actually happens is, because the lactose doesn't get broken down within the gut, it travels to the large intestine unbroken down. And when it gets to the large intestine, it ferments. When it ferments, what happens is it draws gas and water into the bowel, and that's what causes symptoms such as gas and bloating and diarrhea. So it doesn't involve the immune system in any way. The treatment for a dairy allergy is a dairy-free diet, and it's a strict dairy-free diet because a very small amount of protein can cause an allergic reaction. However, if you have IBS or gut issues with a dairy sensitivity, then actually a low lactose diet is what you want to opt for. And that doesn't always necessarily mean dairy-free. Sometimes small amounts of dairy can be tolerated. So the next one that I get asked a lot is, should I go gluten-free? Or people telling me that they have tried a gluten-free diet and it didn't help, even though they are very sure that things like bread and pasta are triggers for them. Now you're going to spot a little bit of a pattern here. Gluten-free diets are required for people who have a gluten allergy. So this is an allergic response to the protein gluten, and it is otherwise known as celiac disease. So people with this condition need to completely cut gluten out of their diet because, as we've discussed before, small amounts of this protein can cause an allergic reaction. So they have to completely avoid gluten. And as we know, foods like bread, pasta, and cereals contain gluten. So these people have to opt for gluten-free alternatives of those foods. Now, also found in bread, pasta, and cereals, and actually many other food groups, are a group of carbohydrates called fructans. Some people who experience gut issues or IBS have an intolerance to fructans, and this is due to their fermentable properties. So again, it's a type of carbohydrate. It's actually specifically a type of fiber, which normally the gut microbiome would break down. Some people who have IBS or gut issues aren't able to break down these fructans. And like the lactose, it travels through the intestines, it gets to the large intestine, it hasn't been broken down, and it's fermentable. So again, it ferments in the large intestine, it draws water and gas into the large intestine, and then it causes symptoms. So once again, a fructan intolerance does not involve the immune system. And therefore, people with a fructan intolerance do not need to adopt a gluten-free diet. They simply need to decrease their intake of fructans. Now, of course, there are some gluten-free products which also happen to be fructan-free because they don't contain wheat, barley, and rye. And those foods, the wheat, the barley, and the rye, they all contain gluten and they all contain fructans. So yes, when you opt for gluten-free versions, sometimes that does automatically mean fructan-free. However, it's really important to be aware that not all gluten-free products are fructan-free. And this is why sometimes people try a gluten-free diet and they don't see an improvement in their symptoms, or they see some improvement of their symptoms, but not much, even though they know that foods such as bread trigger their symptoms. And this may be because people opt for a gluten-free bread that actually still contains these fructans, so they're actually still consuming the fructans. Or it may be because some other food groups also contain fructans. So there are some vegetables that also contain fructans. So they may have opted for a gluten-free bread, and it might just so happen that that gluten-free bread is low fructan. However, if they're also eating these vegetables in their diet which contain fructans, then they're still consuming the fructans, and therefore you're still going to get the symptoms. So to summarize, with celiac disease, the thing causing the issue is gluten, which is a protein. And with IBS with sensitivity to fructans, it's fructans, which is a carbohydrate, and more specifically, a fiber. The body's reaction with celiac disease is an immune response or an allergic reaction. And the body's reaction with IBS with sensitivity to fructans is not an immune response, it's an intolerance. And the treatment for celiac disease is a gluten-free diet, and the treatment for IBS with sensitivity to fructans is a low fructan diet. So last but not least, we're going to go over intolerance testing. There are a huge number of companies which offer intolerance tests, where you buy a kit, you do the test at home, you send it off, and you get the results back. Most of the ones I see involve doing a hair, cheek swab, send off a hair sample, do a cheek swab, or do a finger prick test. And they will set you back anywhere between £50 and £200, depending on where you get them. So how do these tests work? They measure antibodies, and more specifically, they measure a type of antibody called IgG antibodies, which we'll come back to. But as we've just discussed with the dairy and the gluten, food intolerances do not involve the immune system, and therefore they do not involve antibodies. Antibodies are a fundamental part of our immune system. They are part of how our immune system works. If an intolerance is completely independent of the immune system, then what good is measuring antibodies? It's not going to tell you anything about an intolerance because it doesn't involve antibodies. So measuring antibodies tells you nothing whatsoever about intolerances that you may or may not have. There are some antibody tests which are done within the NHS, but these are to measure food allergies, not food intolerances. So remember, we've just said that a food allergy does involve the immune system. A food intolerance does not involve the immune system. So these tests that you can get on the NHS are specifically for food allergies. And in addition to that, they measure a different type of antibody. They measure an antibody called IgE antibodies, which are the antibodies that are involved in allergic reactions to food. So as we've just discussed, these online tests measure IgG antibodies, and all the IgG antibodies show you is what the immune system has been exposed to. So essentially, if you have eaten chicken and you eat chicken on quite a regular basis, then you will probably have a positive IgG response to chicken. If you've never eaten lamb, or if you eat lamb very, very rarely, then you will probably not have an IgG response to lamb. So all that this tells you is what your immune system has been exposed to as a result of what you've eaten. So as you can imagine, people do these tests and they come back as red or intolerant to an absolutely huge list of things because they've measured IgG antibodies. And the likelihood is that that person has eaten all of those foods in the recent past, and so the immune system has been exposed to them, and so they ping up as positive. This leads to people cutting out major food groups of their diet. I've literally had people come to me who have cut out 10 plus different food groups when they're not actually intolerant to them. And it leads to all sorts of problems such as nutrient deficiencies. So overall, online tests will tell you nothing about intolerances because they measure antibodies, and antibodies have nothing to do with intolerances. And then on top of this, most of these companies don't measure the correct antibodies anyway. If you go on the NHS website, you will find this statement, which says a number of companies produce food intolerance tests, but these tests are not based on scientific evidence and are not recommended by the British Dietary Association. So in short, don't waste your money on them. They're not worth it. So moving on, I appreciate that that was quite a lot of information. And that was kind of the heavier stuff, and we're going to move on to a more lighter approach now, so it won't be so information heavy. But I want to go over what a holistic approach is to IBS treatment and what that entails. What does that look like? So holistic basically translates to whole body. And when we're thinking about a holistic approach to IBS treatment, we're basically thinking about a whole body approach. Why is this important? Well, because there is a lot of research that suggests that symptoms of IBS can be caused by a whole range of factors, and therefore it's important to address all of them. IBS is what we refer to as a multifactorial disease. What we mean by this is that for most people, a number of things must happen in order to trigger IBS to occur. So that's why, going back to earlier when I said some people who go on antibiotics may go on to develop IBS, and some people who have antibiotics will never go on to develop IBS, it's because of this multifactorial aspect to the disease. So normally that's taking the antibiotics, for example, is one of many boxes which has been ticked in that particular person, which has gone on to lead them to develop IBS. So it's about, if it's a multifactorial disease, it's about taking a multifactorial approach to treatment. Because if it's a multifactorial disease and we take a singular approach to treatment, we're not likely to be very successful. So of course, food and nutrition does play a role in treatment. And it's something that should be addressed. It plays a huge role, and it's something that we spend lots of time talking about. However, another area which can be equally weighted is the gut-brain axis, which, if you haven't heard of the gut-brain axis before, what we mean by this is the ability of factors produced by the brain to bind to the gut, but also vice versa, and factors produced by the gut that can bind to the brain. We've all heard of the saying nervous poo. And that's exactly what happens. The brain produces factors which go on to circulate around the body. They can bind to receptors on the gut, and it can cause a bowel movement. So that's what we mean by the gut-brain axis. That was a very simplified example, and that's something that most people experience at some point in their life. However, people who have gut issues, it tends to get a whole lot more complicated than that. And there are several ways in which this sort of communication between the gut and the brain can go wrong. So it's something that's really important to look at. Another important factor is the gut microbiome. So when we are thinking about the gut microbiome, what we mean by this is it is a collective term for all of the bacteria, viruses, and fungi that live within our gut. They're good, they're supposed to be there, even though it sounds horrible. They're extremely beneficial to us. And it's actually, the gut microbiome is actually linked to the gut-brain axis because there's growing evidence which is suggesting that different bacteria within the gut can send and receive different messages to the brain. There's also evidence that the gut microbiome may be quite different for people who have IBS compared to people who don't have IBS. So that's something that we also need to look into. And then finally, lifestyle, stress, and anxiety are also really important factors to consider, and they kind of tie into this gut-brain axis approach, because these areas can also influence symptoms. So it's really important to take a holistic approach to treatment when it comes to treating somebody for their gut symptoms. So rather than thinking of things as simply as getting gut symptoms and sitting there thinking, what have I eaten that may have caused this? Instead of thinking like that, it could be, and I hope I've sort of made you realize, it could be a whole lot more complicated than just what have I eaten that may have caused this, which again comes back to when people can't pinpoint things. They haven't eaten anything that they suspect to be a trigger food, and they can't pinpoint what it is that might be causing their symptoms. It's because it can be this whole complicated range of things that can be causing symptoms. So, what should an evidence-based gold standard treatment approach look like? What does the research tell us works? At the moment, research suggests that one-to-one support with a registered professional is essential for the best treatment outcomes. So I said I was going to go over what registered nutritionist means. Unfortunately, in the UK, a nutritionist is not a protected title, unlike dietitians, which is protected. So anybody can call themselves a nutritionist. However, registered nutritionist is a protected title. So those of us who are registered nutritionists, we are registered under the Association for Nutrition. And most of the time, that means that someone's got a degree or more in nutrition. So that's an important factor, that it's a consultation with a registered professional, not just anybody who's not necessarily following an evidence-based approach. So in terms of what that nutritionist or dietitian should be covering with you, first of all, an assessment, which obviously seems obvious, where they will take a history. So they'll be looking at potential things that could have caused your IBS or your gut symptoms, any medications that you may be on, looking at trigger foods and things that you might suspect to be trigger foods, and also looking at other areas that may be playing in, like the gut microbiome and the gut-brain axis. You should receive dietary management advice and guidance and support with changing your diet to avoid trigger foods. And within this, you should also receive support in identifying whether the foods that you think might be trigger foods actually are trigger foods. And also, they should be able to look at, say, a food and symptom diary and identify whether they think that there might be trigger foods which you haven't identified. You should receive education on the gut microbiome, what it is, how it can be different for people with IBS, and an individualized plan for improving your gut microbiome. I'll go over this a little bit more in a moment, but there is no one size fits all for people in terms of their gut microbiome. Your gut microbiome is like your fingerprint. No two people's gut microbiome are the same. So when you're trying to improve somebody's gut microbiome, that can look very different for two different people. So it's very important that that's individualized. Finally, education on the gut-brain axis, how it can affect gut symptoms, and an individualized plan again for improving your symptoms via the gut-brain axis. So what I want to go over is a real-time example of this. So as it's IBS Awareness Month in the UK at the moment, we've put together packages for clients which include all of these things. Now, whether it is that you decide to come and sign up to one of our packages, or which you are more than welcome to, or whether you decide to get treatment at a later date, or whether you decide to get treatment with somebody else, or whether you don't decide to get treatment at all right now, this is the kind of level of treatment that you ideally want to be looking for if this is something that is accessible to you. So for example, with our packages, we have a silver and a gold package. Our silver package includes 4 one-to-one appointments with a registered nutritionist, which is myself. The first appointment looks at an assessment, goes over dietary management and identifying food triggers, and sets out food trials to test food sensitivities. The second appointment is an education session on the gut microbiome, what it is, how research shows it's different for people with IBS, what probiotics are, what prebiotics are, and individualized advice based on your assessment for improving your gut microbiome. Because, as I say, the advice for two different people on improving their gut microbiome can be hugely different. For example, one of the things that we look at is the type of symptoms that you get. Someone who's got very diarrhea dominant IBS compared to someone who's got more of a constipation dominant IBS, we'd be looking at different things for those two different people. We also give out a gut microbiome ebook at that point, so that you get all of the education that you've gone through in the session in an ebook form. The third appointment goes over the gut-brain axis, what it is, how it works, how it can go wrong for people with IBS, and what you can do to try to improve it. And at that point, again, a gut-brain axis ebook is also sent out. The final appointment goes through everything and pulls everything together and goes over long-term management. How do we then transition you from being with us to going off by yourself and continuing to manage your symptoms long-term, so that hopefully you can continue to manage your symptoms for life. There's also a written report after each appointment, so that you never have to remember the information given to you. This is something that is really important, and I would urge you, for any professional that you see, whether it's for IBS or anything, is to always ask for a written report if that is something that is offered. There are lots of studies that have been done where they put people in a clinical setting, such as a doctor's appointment. The doctor relays information to the person, and then after the appointment, the person comes out and they ask them to relay that information to them. What has the doctor told you? Tell me everything that just happened in your appointment. What those studies find is that we are not very good at relaying information or remembering information correctly. So having a written report is essential to make sure that you, can go back and look at that, and you don't have to remember it. You can go back to your written report and you can see the information there for you. And B, you don't have to spend your appointment trying to remember things or write things down, because it all gets given to you. And from a professional point of view, so from my end, I can be confident that you've been given all of the information in black and white in writing, so there's less chance of you getting things wrong or not being sure about things. So we also do weekly online check-ins, and we also do ongoing analysis of food and symptom diaries. And there's also hypnotherapy recordings, which can be followed alongside at home, as well as many other resources which members get access to a members-only area of the website and can access additional resources. Our gold package includes all of this, but in addition, it includes 2 appointments with our clinical hypnotherapist. And that is to really tackle IBS from that gut-brain axis point of view. So it's really appropriate for people who suffer a lot with stress and anxiety and things like that. Now, as I said, you are more than welcome to find out more information about our packages, which can be done fully online. And if you want more information, I can let you know how to go about that. My email is going to be at the end of the webinar, so you can drop me an email. However, even if this isn't something that interests you, I just want to show you the level of detail that treatment should go into, and all of the different angles that we need to approach IBS treatment from. So when you do see these one approach treatment options, or even something that simplifies gut issue treatment down to something really small, like a singular supplement, you can be aware that it is hugely more complex than that, and that a gold standard evidence-based treatment approach should be looking at all of these different angles in order to get the best outcome for you. So I just want to leave you with this study, which was done in 2020. So it's a nice recent study, which gives a really nice insight into different treatment approaches and what seems to be effective. So they took people who had been diagnosed with IBS and they put them into one of 3 groups. So 15 people had one-to-one support from a registered nutrition professional. 17 people were given an app to download. 19 people were given a leaflet which contained information. And then a week later, they asked people how confident they felt to implement the dietary changes. And then 4 weeks later, they asked people whether they'd had an improvement in their symptoms. So of these groups, in the one-to-one support group, 64% of those people felt confident to implement dietary changes, whereas only 13% felt confident who'd been given the app, and only 6% felt confident who'd been given a leaflet. After 4 weeks, 80% of the people who had one-to-one support felt that they had had an improvement in their symptoms, whereas only 63% felt that they'd had an improvement in the app group, and only 39% in the leaflet group. What's really interesting is that when we do studies looking at gut symptoms and ways that we can go about treating them, most studies will normally have a treatment group and a control group. So they'll put people in a treatment group. So for example, there's a study off the top of my head that looks at yoga and the effectiveness of yoga on IBS. And so they had people in a treatment group. So those people they gave yoga sessions to, and they had people in a control group. So those people they didn't give yoga sessions to. And what you tend to find is that even in the control groups who don't get given any treatment at all, you tend to find across the studies that roughly about 40% of people will report an improvement in their symptoms. So just knowing, because most people don't know whether they've been put in the control group or the treatment group, they're not always told the main outcomes of the study, because obviously it makes it less biased. So most people just purely being aware that they are part of a study that looks at IBS treatment, 40% of those people report an improvement in their symptoms, even though they've had no treatment whatsoever. And it goes to show the power of the gut-brain axis. That really does go to show the power that it can have on symptoms. However, what's really interesting is from this study, we can see that the people who were given a leaflet containing information, 39% of those people felt that they had an improvement in their symptoms, which is really similar to that 40% that we tend to see in control groups who don't have any treatment whatsoever. So actually, being given a leaflet containing information is comparable to not getting any treatment at all. So that's just really interesting and something that's worth bearing in mind and considering, because a lot of the time we do find that people go to their GP and present with gut symptoms and get given a leaflet, maybe on the low FODMAP diet. And this is why we don't tend to see good treatment outcomes from that. So I just thought that was an interesting thing to leave you with. So I'm going to leave it there. If you have any questions, then please don't hesitate to ask them. And if you don't want to ask a question on here, or if you are watching back this recording, which I know a lot of you are, then please feel free to drop me over an email. My email address is nutritionist@andrahealth.com, and you can send me an email over there if you have any questions, and I'll be more than happy to answer any questions that you may have. And for the two of you that are on the webinar, you may either unmute yourself if you have a question or pop it in the chat box, or if you don't have any questions, then feel free to head off, and that will be the end of the webinar. So I'll just give you a couple of minutes just in case anyone wants to put anything in the chat, or if anyone wants to unmute themselves and ask any questions, and otherwise we'll leave it there. And thank you for listening.